Hello everyone, today I am going to talk about pathophysiology and pharmacology of cystic fibrosis. So what is CF? It is an autosomal recessive disease and it is a disease caused by mutated gene. Those mutated genes are inherited from both parents. It's called CFTR, cystic fibrosis conductance regulator. This gene can be found at chromosome 7, and there are 6 classes of CFTR gene that could cause the disease. This is a life-threatening disease that is affects multi-symptom, including respiratory, GI tract, and reproductive system. You can see here on the picture, there are 6 classes of the CFTR gene mutation, and today we are going to focus on the most common is class 2, the alteration in maturation or transport. So in this case, chloride channel may be folded incorrectly or might not be transported to plasma membrane. I will talk about this in the next few slides. So what is the real pathophysiology of CFTR? CFTR affects the CFTR protein, and this protein is chloride ion transport activator. In normal patient, those protein allow the chloride ion to pass through the transmembrane to reach outside of the cell. However, in our patient, because of those protein is impaired, so the chloride ion could not pass the transmembrane, so it will lead to less chloride ion to pass the surfaces, and sodium ion also will be reabsorbed back into the intracellular space. And water follows sodium, so as a result, more water will be reabsorbed into the cell. So you can see here on the picture on the right side, the green area, it is the mucus layer. It's thicker compared to the left hand side. Because why? Because of the water being reabsorbed, so the mucus become dehydrated and thickened. So what happened to our patient Jacob? The mucus will obstruct his airway and he will have problem with breathing. In this picture, so CFTR gene mutation, it is characterized by three components: mucus plugging, chronic infection, and chronic inflammation. So because the mucus plug-in formed by thickened and dehydrated mucus, it attracts the neutrophil to the side to kill the pathogen. But because the mucus is sticky, so it trap excessive number of neutrophil at the side, and neutrophil also release byproducts, and by those byproducts also damage the lung tissue. And as a result, chronic inflammation occur all over and over again. It generally weaken the immune system, and those cycles all happen again with those three components. And it's weaken our patient, and the patient becomes fatigued in the long term. So, pharmacology of medication. So previous textbook has mentioned about the using of anti-inflammatory and bronchodilator and mucolytics for management of the respiratory symptom for patients with CF. However, there is one breakthrough medication called CFTR modulator that has been used widespread lately. The name itself, CFTR modulator. Mechanism of those drugs. So these drugs can either potentiate the CFTR channel. So you can see here on the picture at the surface of the cells, it helps to increase the function of those protein channel. So more chloride will be able to pass through the transmembrane into the other side of the cell. This drug could also be a corrector, so it corrects the function of this protein, so it allows the protein to reach to the surface of the cell, to the surface of the cells. The medication could also be a production corrector, so it's correct the producing of those protein. So the CFTR modulator therapy is the combination between potentiators and one or two corrector and production of the correctors. Nursing consideration for this medication are this medication is expensive, so it is maybe a barrier for the patient to access the medication. In addition, the patient education status and social economies could also affect into the adherence of those medication. And finally, the patient should use those medication in combination with the bronchodilator, mucolytic, and anti-inflammatory for the best outcome for the patient health. And here are the references that I use for my presentation. So thank you for listening.